Welcome back. Module 2 here, biomechanics. Hey, we're going to be really looking and diving deep into the different movement intricacies of the upper cervical spine. There's going to be two joints specifically that we discuss. It's going to be CO, C1, and then C1, C2, and we'll really share why they are different than the rest of the spine. So starting off here, Atlanto occipital joint. This is literally where the occiput meets the top bone in the neck, the atlas. Now, in order to understand this joint, we've got to discuss the anatomy in a little bit more detail. Now, of course, remember, we have these two protruding surfaces. They are convex surfaces known as condyles, and those are meant to rest inside the atlas, because with the atlas it also has two indented concave surfaces meant just for the condyles to rest inside. And of course, as they are connected by muscles, ligaments, and tendons and other soft tissue, we discussed a lot of those earlier. Now you have two movements with this joint, and they're very limited. Now this is called the yes joint, because in order for you to say yes, you nod your head up and down. And again, this is about 10 degrees of flexion and extension with this joint. Now, of course, you're also going to have a little bit of lateral flexion, about 5 degrees, not much, and then no rotation whatsoever. Okay, with the Atlanto axial joints, you have a lot more rotation here. In fact, 50% of all rotational head movement comes from C1, C2. Think of this as being the no joint, right? You turn your head right, turn your head left, you're going to gesture no. Now at the bottom of the atlas, right here, this is the bottom, it's going to look very similar to the top. You're going to have, again, two indented concave surfaces for the superior surface of C2 to fit inside. Now, if you look at we've got the occiput and C2, both with convex surfaces to fit in both inferior and superior aspects of the concave atlas. Again, going to be joined together by a lot of the ligaments that we discussed and the muscles. Now with this one, of course, it's also very different than the rest. There's no interlocking joints. It's held together by muscles and ligaments. There's no spinal discs here. To increase the stability, it's just going to be muscles. So it's very unstable. But there's, a reason why you can do that with your head. Like, look at all the range of motion you have. That's because of the CO, C1, C2 joint anatomy. Just think about it. If you did have a disc and interlocking facet joints, there's no way that you would have the amount of mobility in your head and your neck than you do right now. Now, with what comes increased mobility is also going to come vulnerability. Now, this is why where the head meets the neck is the most susceptible to injuring and misaligning. So we want to be sure to accurately assess and treat this area when it is injured. It's very similar to the shoulder joint, right? With the shoulder, you have a lot of mobility, but with that increase in mobility, you have high risk of injury, which is why we see so many shoulder injuries compared to other parts of your body. Of course, the head and the neck is 1,000 times more important than the shoulder, but that's a topic for another day. Okay, I hope that helps. That is all we have for the biomechanics module. I look forward to seeing you for the neurology module.